I'm Mark Farrugia. I'm a radiation oncologist at Roswell Park Comprehensive Cancer Center. Today we're here to talk about adaptive radiation therapy. Adaptive radiation therapy is different than conventional radiation therapy because it's able to account for real-time changes in both the position of the tumor we are treating as well as the surrounding anatomy. Conventional radiation therapy involves having a CT scan, often called a mapping session or a simulation CT scan, which we use to design a patient's radiation treatment plan. We know, however, that many areas of the body, particularly the abdomen and pelvis, have conditions that can change from that planning CT scan to the time of delivery. What adaptive radiation therapy is able to do is to account for these changing conditions with the anatomy or tumor. When we go to treat a patient, if, say, their bladder is more full than it was at the simulation scan, or an element of bowel is closer to the tumor than it was at the planning scan, we're able to adjust or adapt our radiation plan to account for these changing conditions. The ultimate goal for this is to spare the normal anatomy that we don't want to treat to a greater degree, and also give higher doses of radiation to the tumor we want to treat. Typically, with conventional radiotherapy, it takes about 7 to 10 work days to generate a radiation plan from the time of simulation to the first treatment. This involves a lot of work between the treatment care team, by myself, as well as radiation planners known as dosimetrists, and medical physicists to ensure that the radiation plan is functioning as intended. Using an AI-based software, we're able to condense that 7 to 10 workdays into about 15 minutes. Our AI-based software is able to rapidly delineate both the normal anatomy as well as the tumor we're intending to treat. It's able to generate a radiation plan to optimize the radiation delivery in real time. This allows us to greatly reduce the amount of time that it would take us to do this manually and make it more actually feasible to deliver adaptive radiotherapy in this context. We do what we call a cone beam CT or a CT scan prior to delivering the radiation treatment. Primarily in the past, this has been done just to localize the tumor to ensure we are accurate and in the right place. However, with adaptive radiotherapy, this localization or cone beam CT could be used in place of the planning CT. So basically, we're able to reproduce that process, that simulation process, on the treatment table to regenerate the radiation plan. The number of sessions will depend on the prescribed number of radiation treatments. And so if you're planned for, say, 5 radiation treatments, we will redo a CT and redo a radiation plan 5 times. The benefit is clear. Generally, with this technique, we're able to ensure that the tumor or the target we are treating typically receives a better prescribed dose than via the conventional method, and typically we're able to better spare the organs that are nearby. As we know, the side effects of radiation are a consequence of how much dose or radiation dose the surrounding structures receive. Thereby, by reducing the amount of dose those organs get, we should be reducing side effects associated with treatment. Similarly, the amount of radiation dose we give to the tumor can correlate to our ability to control the tumor. So our better ability to give radiation dose accurately to the tumor can result to better improved outcomes. Adaptive radiotherapy is uniquely suitable for treating tumors which are in locations that typically have variable positioning of anatomy. Classically, this can be considered the abdomen or the pelvis. In the abdomen, a patient's bowels can be in a different position. Their stomach can be more or less full. There's a lot of critical structures that are nearby, which adaptive radiotherapy is uniquely suitable to ensure that we're maximally sparing those areas. Similarly, the pelvis can have varying fill states of the bladder as rectum, which often can be challenging to account for in a day of treatment. A patient's bladder can be more or less full, the rectum can be more or less full, and this can dramatically alter the dosage of radiation those areas are going to receive. Adaptive radiotherapy can be used in many contexts, but often it's utilized in patients who have tumors involving the adrenal glands, the liver, the pelvis, which can be including the prostate, lower rectum, and gynecologic cancers in women. The Ethos-based platform represents a state-of-the-art technology for CT-based adaptive radiotherapy. It's uniquely suitable for delivering radiation therapy in very challenging cases. Our team is extremely experienced in handling the most complex patients, and the Ethos platform gives us technology to deliver radiation therapy in the most effective and safest way possible. If you have a patient you think may benefit from this technology, please contact us at Roswell Park to see if they may be suitable.